I'm weak everywhere. So can I help you with the stand pivot?
No.
Probably not. Can I help you with
It's gonna be
a dependent? Okay.
Dependent transfer.
I don't transfer and bend, like just sit up.
It's going to be the same. I mean, it's still going to be a max transfer.
Yeah, just like you can't sit yourself up.
No, you would just have to help me more to sit
Okay.
down, but essentially you'll perform it the same way.
Okay.
Is there ever a time when the log roll's not okay to roll somebody, or?
No, the log roll is usually fine. I like to do the segmental roll when I can, just because then their legs are already bent up. And I just bend them over and then they're already in the position to sit up. It's just my personal preference. Yes, through the teeth first. I'm going to try to make sure it's not twisted. There you go.
With the segmental roll, if their left side, like the first scenario, the left side was hemostasis, or you say that, you can't really do that because they can't reach to pull their self standing from the, because when you're doing the segmental, they're reaching to pull for the bed rail, right?
With any of the rolls, you can let them assist with that. It's more that you don't want to roll them onto their weak side, okay, because their shoulders could dislocate and things. So if somebody has hemiparesis, you want that to be the top side. So that's why we moved it. When I was down here, I would have rolled onto my left side, and then they can't help you, push through that arm. For this one, they're really weak everywhere. It doesn't really matter which side you roll them to. And it doesn't matter which side you transfer to. So there might be some scenarios where it doesn't matter which side. But if you have something that really has one-sided weakness, whether it's a total knee replacement and they're really weak on one side, then you need to transfer to the strong side. So anytime one side is really, really weak, you need to transfer towards the good side. Okay?
As well as rolling to the good side?
It's only with really like a stroke that you need to not roll over the weak side.
Okay.
Can you think of any other times where you really watch that?
Or a hip replacement.
Oh, that's true, that's true. We probably won't have any hip replacements just because that's a whole other ball of wax.
All problems.
Under my hip, pelvis. And give me a 1, 2, 3.
1, 2, 3.
Good. And I would even rock a little bit on the 1, 2, 3.
So I have to help you more on this one, right? So I grab under your shoulder. Swing your
And
leg.
it would be easier if my legs were bent because that makes me a little bit smaller.
Okay. 1, 2, 3.
It's hard to be dependent, isn't it?
You can ask your aide to
Lower
lower
the
the neck.
just a little.
Can you help us like that during the test?
If we need to be your aide, you can ask your aide to help you. And it's easier to help from here. Okay, there you go. So you can really pull them forward. Okay, good.
So you throw it like me, it's like,
Okay, now which way is my bottom going? Okay, and then this is the one where you really want to bend me down. Bend me down. Like under.
oh, there you go.
There you go.
Okay,
Weird.
1, 2, 3.
There you go.
And I probably couldn't grab. So for those,
I just have to.
you just get me in there, and then you can kind of scoot me back. Like you can even use your knees and kind of like scoot my.
Oh,
There you go.
I
Kinda
didn't
push me
get to
back.
see the
Kind of go here. There you go. There you go.
leg positioning on that one. Is that one where you're kind of in between their legs?
You don't have to. You can kind of position theirs so one's here and so that they can pivot a little easier. I probably even would have brought this chair in a little bit. It seemed like it was a little bit far out. So I always have it right next to the thing and as close as I can so that it's here. And that's all the further you have to get them.
Head goes like.
Remember your bottom and your head, it's like a seesaw, they go opposite. If I want my rear end to go this way, my head goes the other way.
No, for that one, your head goes under her.
It went all the way down, yes, because it puts my head lower, so it already starts raising my rear end up. Okay, sorry. Okay, so that was good. Any other feedback? Feedback, okay. Who wants to be my next therapist? Okay, Mindy's gonna go, okay. Okay, so it's our 68-year-old with the, who's had a stroke, okay? Right side hemiparesis and left lower extremity full strength. So what do you think? What
Well,
change do you think you're gonna
let's
see?
see. Well, actually, stand pivot,
Okay, why?
because you have full strength in your left lower extremity.
Okay. And they could probably get all the way up to stand.
Yeah.
Okay, so show us how you're gonna prepare.
Okay, well, let's see. The right side, the left side, and turn it around.
That's right.
Because when I sit up, which direction will be my left side?
Oh, the one it's on right now, never mind.
No, you had it right.
Oh, I didn't?
Turn it
Yeah, you were doing it right.
You were doing it right. Don't overthink it.
You doubted yourself.
Just turn yourself around and think, okay, when I'm the
Yeah.
patient and I'm up, I wanna go to my left side.
Yeah.
So that's what I
Often
do.
do that at work.
I got my left and right mixed up.
But the patient needs to be able a different way when she gets up.
Because you're
Her
swing
feet
your
are going to
legs.
touch the
when you hit
wheelchair.
the wheelchair.
Well,
Oh,
and I
that's
have
right.
Yeah.
right-sided hemiparesis, so do you want me turning on my?
No, you
Right?
don't, okay.
Okay.
Then put her feet up.
So I need to,
So we would,
that's
for
what I meant
our
by changing.
purposes,
She has to switch
you could
sides.
put the wheelchair on that side, so then I would turn to the left.
Right, that's what I meant, use your head down here, because that's what I was confused about. Your side.
Anytime
If this
there's
would be your bad side, you don't leave your bad side.
Yeah, I don't wanna roll onto my left.
Right.
If somebody's in a hospital,
Yeah,
I would have to then take the chair over
Right.
there, so that they would roll
Yeah,
to their
over
good
that.
side, and then sit up, and then my left would be my good side, so my chair would have to be here.
Okay.
Okay? I know everybody's out here, our audience is there, so I'm trying to like, okay. So the chair's still fine, because when I
Chair's still fine. Okay. Let me
Am I
get it ready.
confusing
I know.
everybody?
I'm trying to think.
I'm just trying
Their
to do
faces
it.
look confused. Right side weakness, you always go to the good side.
But she
I guess
switched
that's the way
around.
that she- Yeah.
You just
But,
grab their
but
confidence.
she's
Yeah,
still,
but
she
you're
switched
still-
around, but she's still, when she sits
It's
up,
still
she's
not
still
stood
gonna
up, I'm
be,
still gonna
She's
be.
still,
Still gonna be accurate.
yeah, her left side.
I just did it so that when I rolled, I wouldn't roll
Yeah.
over my
Very
back.
simplistic.
yeah.
So we wanna roll
The left
You just
side.
gotta
to the
think
good
right
side.
and left, that's all.
Are we doing the 68 year old?
Yes.
The left side has full strength.
Real snug. There you go.
Okay. So, is it okay to do a lobber on this one?
Is there any reason why you could?
No, I guess so, because I have to, all right, so you're gonna cross your, I don't want right there, I want right here,
Mhm.
your arms up here.
And you're gonna give me your rock.
I'm gonna give you a 1, 2, 3.
Okay.
1, 2.
That was a good rock. That gave me a lot of momentum.
And then, next we're gonna bend your knees, and bend your legs there, and then, whatever. And, hold on, I'm confused how to do it.
Your bottom, this one has to come underneath.
Underneath this way, that's what I was confused. Okay.
And there you go, kind of here at my shoulder blade, there you go.
So on the count of 3, I'm gonna sit you up. And we're gonna be going this way.
Okay.
1, 2, 3. And you can push off your left arm right, because you still have strength at that.
You could have
Okay.
told me to push on my
And
left.
then, well, when you're helping them up like that, you don't actually have to hold the gate belt until now, right?
Right,
Okay.
because you're under here and here, and then once they're up, the gate belt's there, so you.
Okay, so now I'm going to do the stand pivot.
Okay.
Okay, it's been a minute. So we're gonna stand on
is, so if it starts to buckle,
Oh,
kind of
okay.
crossed over, okay? Okay, and my hips are back far, so it would probably be helpful if,
The stitches,
mhm.
and then you scoot forward, and then,
The
let's
chair
see.
a little closer.
I was gonna say, that's a little far, there you go.
But we're gonna stand all the way up on this leg, right?
But you don't wanna have to move me too much, so you still want it,
So I'm gonna have you go,
you can kinda almost kinda go top to bottom. Is my head on the right side?
yeah.
Yes, okay. Are my hips close to the mat?
Mhm.
Yes. Are my feet in a good position?
Yes.
Yes, now they are. Okay.
And that's because you're putting this one forward a little bit, right? So I'm blocking
Yeah,
the
just a
back.
hair.
Okay, so on the count of three, I'm gonna stand you up.
You'll say on the count of three, we're gonna stand, we're gonna pivot around, and then I want you to reach back and lower yourself
Okay.
into the chair.
Count of three, we're gonna stand
And come a little
and,
closer to me.
pivot around. Then you're gonna reach back for the chair arm.
Okay.
With your left side.
Okay.
Ready? 1,